Greetings, my Beyond the Care family, and welcome to another episode of the Beyond the Care podcast. So today's guest is a treat. She is not only a good friend of mine, but she is a dynamic OBGYN and physician. Dr. Afriye Amerson comes with a wealth of knowledge. And so today she'll talk about some practical tips for caregivers, and as always, she will keep it real. So I am so excited to introduce and welcome to the Beyond the Care family, Dr. Afriye Amerson. And I do know that something that you hear today will definitely spark something in you and will resonate with you. So welcome, Dr. Afriye Amerson, medical doctor extraordinaire. Greetings, my Beyond the Care podcast family. Now, I am really excited about today's guest. She is a phenomenal doctor and someone who I have the pleasure of calling a very good friend. So hello, Dr. Amerson.
Dr. Paula, it is so wonderful to meet your podcast audience. I am honored to meet a bunch of first responders. Anybody viewing this podcast is a first responder. You are constantly on duty, caring for somebody you greatly love. So that's so important, Paula. And in 25 years of caring for women, I have truly seen what care providing is like and the toll it brings.
Well, that's why I have you on. So before you get into what you do best, let me introduce you formally. So Dr. Afriye Amerson is a board-certified obstetrician and gynecologist. She's licensed in New Jersey and Illinois and practices in Illinois. During her training at George Washington Medical School, Dr. Amerson also studied Eastern and African healing arts. She became a Reiki master and practices holistic healing as well as traditional Western medicine. In private and hospital practice for the past, now your bio says 18 years, but I know it's longer than that because I've known you 20 years. So we're going to say 25 years, what you just said. Dr. Amerson has encountered a wide spectrum of issues facing women's health and families. Issues that are so vast, I can't even read them all: gynecology, surgery, prenatal care, counseling on sexual health and wellness, marriage, depression, grief, HIV, and infertility. She has become a well-known speaker throughout the community, engaging audiences of churches, civic organizations, youth mentoring organizations, and corporations. Dr. Amerson has appeared as a health expert on several national television shows, such as The Tyra Banks Show, radio blogs, and magazines. Affectionately known as Dr. A by nurses, patients, and many hospital and office staff, she is a passionate advocate for the health awareness and empowerment of the community. So again, welcome, and thank you for being here today.
It's such an honor to be with your audience, Paula. This is the 12th day of February that we're recording. And this is the day of the inauguration of the NAACP.
It is.
So, on this day in 1909, literally, we came together as a race of people to say collaboratively, we are going to have a voice. And collective, we go further. We may go faster as an individual, but we go further as a team. That's kind of what your podcast is all about. When we have the extremes of age, whether it's an elder or the very young. My mother has a school, Paula, as you know, and her school starts at 6 weeks. So that's right out the womb.
Right.
At either extreme of age, it takes a village.
That's right. So, you and I were talking about the podcast, and although your training is in OBGYN, you have a vast amount of experience across the spectrum. So just looking at this podcast that's focused on caregivers. And one of the things we talked about is that the research showed that caregivers have higher rates of stress, depression, anxiety, heart disease. You know, how do you respond to caregivers? And what do you say to caregivers, or what are some of the things that caregivers should keep in the back of their minds as they're caring for someone, a loved one or a family member or a friend?
Thank you for that, Paula. That question's answer really began at the start of medical training.
Mhm.
Because my specialty is OBGYN, the first caregivers that I encountered medically were mothers.
Absolutely.
And so realizing whether the young woman becomes a mother at puberty, 9, 10, 11 years old, which happens,
Mm-hmm.
or she becomes a mother within the context of a marriage, a supportive husband, a prosperous career. Either way, the bottom line, Paula, as you know, you are a mother successfully of a male and female child. So again, you know the spectrum, which I learned vicariously because I'm not a biological mother. Mothers taught me that the degree to which they put themselves second is perpetual. It doesn't stop at puberty. It doesn't stop at college age. It doesn't stop when that child is married with their own children.
Mm-hmm.
The umbilical cord literally is never cut. And so then I learned about the more of the diaspora of caregivers, which is when I went into private practice and had women of all ages. Then I encountered menopausal women caring for elderly parents. I encountered both genders because since the woman is the pivotal axis of the family, as you know, Dr. Paula,
Mm-hmm.
oftentimes the whole family comes to my office. That means the husband is there. Not only do I encounter husbands in the labor room, I encounter husbands in the office because the woman as the central pivotal axis may engage children and husband, and everybody is at that visit because the OBGYN becomes much more than just the gynecologist. You are a psychologist, a social worker, a psychiatrist, an internal medicine doctor, a pediatrician. You're the go-to. So they will bring their husbands, and so I get to see the male lens of being a care provider for an elder parent, etc. And as you said, Paula, the consequence is real. Even before the disease manifestation, high blood pressure, diabetes, uh, autoimmune disease you left out. Now,
Mm-hmm.
African Americans are disproportionately affected by every autoimmune disease. We lost one of my favorite comedians, Bernie Mac, to sarcoidosis.
Sarcoidosis. Yep. Mm-hmm.
We also have lupus that's rampant. One of my best friends could not be a bridesmaid because lupus has so catastrophically affected her life.
Mm-hmm.
So, all of the autoimmune diseases are more likely to caregivers.
Mm.
But before you have a disease, Paula, you have symptoms.
Okay.
And so many of the things, number one, I think what's central, I'm going to be very honest, is
Mm-hmm.
starting your day. The first hour of a caregiver's day, it's really got to be about self. So if you go on duty, okay, as you know, Dr. Paula, because we're very close. I
Mm-hmm.
many times for many decades as a private practitioner would start surgery at 6:30 a.m. But if I've got somebody in labor, that's an up all-nighter. So I could literally go from the labor room to the operating room. No me time.
Mm-hmm.
This is part of why I never had children, because I'm going to get my me time.
Mm-hmm.
I don't care
Mm-hmm.
if it's in the bathroom. And
Mm-hmm.
now with a husband, I lock the bathroom door. No, I have to do me time. And so I learned as a physician, I will burn out and die.
Mm.
I can't be anybody's first responder unless I'm that to myself. So,
Right.
Paula, what I advocate, most people are not on a 24-hour, 48-hour, 96-hour shift. This
Right.
is why doctors, it's a well known fact, die younger than the average population. It's that first responder, the toll of it. Okay.
Mm-hmm. Mm-hmm.
Doctors, I can tell you, become less self-aware. You almost tune out or numb out yourself so that you can care for others.
Mm-hmm.
I've seen mothers do it. Mothers become unaware that their vision is going blurry, that they're seeing spots in front of their eyes. This is part of the why the obstetrician has to ask these questions. It's
Mm-hmm.
happening, but she's paying so much attention to the rhythm of the baby's feed schedule, sleep schedule, doo-doo schedule, pee-pee schedule. It's all extremely important in those first months. So
Mm-hmm.
she's lost track of her own doo-doo schedule, pee-pee schedule, eat
Mm-hmm.
schedule. Okay. And so the doctor's got to ask her, how heavy are you bleeding? When's the last time you had a bowel movement?
Mm-hmm.
So universalize that message, Paula, to every care provider. Do you even know how often you're having a bowel movement? Do you
Mm-hmm.
know the rhythm of your menstrual cycle, women? Do you
Mm-hmm.
understand your sleep cycle? Do you have a normal circadian rhythm?
Right.
Because if you don't, you're already going downhill to a diagnosis of a disease. Okay. So, number one, you've got to start your day with self.
Mm.
If
Okay.
you go on duty at 7 a.m., you better get up like the news reporter at 5. Okay. Those beautiful people we see on air telling us about the traffic and the weather, they're up at 3:30 in the morning.
Yes.
So it is possible. All right.
Mm-hmm. Mm-hmm.
So, care providers, you may have to rise early and sleep early. All elderly, sundown, and so they've got to go to bed early. So, you too. Why should you be up clubbing when you know you got to be on duty with this elder? You can't. You can't burn the candle at both ends. Okay.
Mm-hmm.
So, go to bed early, wake up early,
Mm-hmm.
meditate, have a candle, have a night. Right now in this office, Dr. Paula, I've got my candle, okay? Pink sands, because my husband and I met in Bermuda. I've
Mm-hmm.
got the lighting as I like it. I've got the
Mm-hmm.
heat on, so I'm the right temperature. I'm
Mm-hmm. Mm-hmm.
comfortable. I'm
Right.
comfortable. But what if I weren't and I'm trying to pour in to your audience? It doesn't work. Same thing if I go to the office and I'm constipated, tired, hungry. I'm off. I'm off
Mm-hmm.
center. And yet I'm
Mm-hmm.
supposed to pour into 40 patients? That doesn't make sense, right? So, no more so than you would want your surgeon to take
Mm-hmm.
you in for a hysterectomy and they're off kilter. They're at 60%. Why should you, as a caregiver, be at 60% for the elder that you're caring for? It's not
Mm-hmm.
fair. You're more prone to be irritable, angry, snap, just be off center, miss
Mm-hmm.
certain cues. The elder could be giving you cues that they need a physician, they need a medical appointment, and you're going to miss it all because you're seeing double.
Mm-hmm. Okay, see, my audience doesn't know you like I know you, and this is why I love you because you keep it real. You're gonna say it how it needs to be said, and I just thank you for that. So you just brought up a key point that we're caregivers as mom, that is where it starts. You don't think of being a mother as a caregiver in that sense, is that when you're older and you're caring for your parent, you don't think of it the same way, but you totally put that in perspective. And, another key point, like they always say on the airplane, put your mask on first.
You got it.
Because if you don't have your mask on first, if you don't save yourself first, then you can't save anyone else. So that is so critical.
And the thing is, Dr. Paulo, it's so
Mm-hmm.
clear to us when it's somebody else, okay?
Mm-hmm.
It's
Mm-hmm.
so clear to the broad audience that it's
Mm-hmm.
not fair to them if their
Mm-hmm.
doctor or the airline pilot is
Mm-hmm.
at half fuel,
Right,
okay?
right.
If your
Mm-hmm.
surgeon shows up and they are deprived,
Mm-hmm.
okay, then you clearly understand as a patient that's not fair to you that they're taking you under the knife,
That's
okay?
right.
So,
Mm-hmm.
as a first responder pilot, a first responder surgeon, they
Mm-hmm.
got to be at 100% medical legally, right?
Mm-hmm.
So, it should
Mm-hmm.
apply to every first responder, be at 100%. Anything else is, it's not just unfair to you, it's unfair to your
For your
patient.
patient. And I love it. First responders, we're going to start calling caregivers first responders because you are that first line of care. I just love it. See, look at you. You dropping knowledge already. So, we talked about all of these diseases and health, concerns and health issues that caregivers may go through. What signs should they look for, and when should they seek medical assistance?
That's such a poignant question, Paula. Let me first give some suggestions to avoid, because they say an ounce of prevention is worth a pound of cure. So
Mm-hmm.
I already started with your circadian rhythm, and that is where it starts. If your
Sleep.
sleep wake, yeah, we know this as women in our 50s, right? The menopause is real.
Ooh,
And I
child.
always teach my patients it's a revision and a revisitation of puberty.
Mm,
Difference is youth rebound. Okay.
mm,
We don't. So um there are even ways to fortify oneself against all the grievance of menopause. But
mm-hmm,
it really, everything, Dr. Paula, starts with the sleep wake cycle. Okay.
mm,
So starting there, which is where I started, 10, 15 minutes ago,
mm-hmm.
that if you are not on a 46, 98-hour schedule, give yourself grace. Okay. Go to bed early, regularly, wake up early, regularly. It helps you to
It's
be a
so hard.
balanced and centered and grounded care provider. So
Mm-hmm.
you're right, it's hard because A, you're a mother. B, you work full time. C, you run a podcast. D, you can't stop, won't stop being a civic mayor. No, you can't stop. You're in so many nonprofits, it's ridiculous.
I'm cutting back. I'm cutting back.
So, even Dr. Paula is learning balance, right? She needs to learn how to goof off more.
Mm, mm-hmm.
I can tell you as her good friend, Dr. Paula, either she's doing what she calls a hobby is being an exceptional party planner. Like, what? That's a whole nother career. Okay. But to do
Yeah.
nothing, I don't think she knows how to do nothing. She could cook, she could do this, she could do that. Ask her, and she's going to figure it out. Um, so for the rest of y'all that cannot
Mm-hmm.
keep up with Roger Rabbit, what you need to do is to woosah. And the
Mm,
woosah and taking breaks. Okay, I'm telling you, if you can't keep up with an elder, you're not fully fueled. Either you're not eating right,
mm-hmm.
exercising right, sleeping right. Because there's no way an elder should be running laps around you. No way a toddler should run laps around you. Okay.
Mm-hmm.
Again, we say this to young mothers, 22, 23 years old. You should be able to master two, three kids. Why? Because you have a regular sleep wake cycle, you
Mm-hmm.
have a team approach. So, care providers, first responders, have a team approach, a village approach. If there are three children, why should one wait, all the burden? Okay. If
Mm-hmm.
I'm doing the time, somebody else needs to do the money and
Mm-hmm.
somebody else needs to do the appointments.
Mm-hmm.
I do
Mm-hmm.
the at home. I'm not doing the everything. No.
Mm-hmm.
So I have a part, and we are,
Mm-hmm.
unless I'm an only child. And if I'm an
Mm-hmm.
only child, I may need to hire a nurse. Actually, before I came on your podcast, my 79-year-old mother, who you know well,
Mm-hmm.
she wanted to run the show. She goes, Afriye, you have to tell them you hire somebody. I said, no, mommy. Some people really, they want to be hands on.
Yeah.
And this is their
Yeah.
loved one. So they don't want
Mm-hmm.
to hire. But the team approach does work. Okay.
Mm-hmm.
So even if you want to be hands on, that's just like Cardi B. She's got
Mm-hmm.
4 children.
That's right.
She likes to be hands-on, even though
That's
she's a
right.
multimillionaire.
Yep.
She want to change the diaper. She want to take him to school, but she gonna
Mm-hmm.
pay somebody to do the behind-the-scenes work. Okay,
Mm-hmm.
pack the lunch, run the water for the bath for 4 kids,
Mm-hmm.
run my bath too, make my dinner, uh,
Mm-hmm.
uh, uh, pick my clothes for the next 2 weeks. You
Right.
cannot do it all. And she's
Mm-hmm.
got a driver, so she can sit, in the car playing with 4 kids. She ain't got to drive nowhere.
Mm-hmm.
So the point to the care providers:
Mm-hmm.
do a part, have a
Mm.
team, take
Okay.
breaks,
Mm-hmm.
have a regular circadian rhythm that you don't disturb. Those things are going to change everything. Some of you need supplements. Some of you
Mm-hmm.
need daily vitamins. When do you need to see a doctor? There are too many symptoms to list, Dr. Paula.
Okay.
But the point is, if you're not in touch with yourself, you're going to miss all the symptoms, right?
Mm-hmm.
If you're seeing double, if you're seeing spots in front of your eyes, if your body is changing in any way. All of those things are reasons to see a doctor. You're dizzy. You have vertigo out of nowhere. You suddenly have chest pain. You're short of breath. But you will, I promise you, you're going to miss all of that. A Black woman walked into my office in the middle of having a stroke. Dr. Paula, she was out of touch with her own self. She wasn't pregnant. She wasn't elderly. She was intelligent. But she was tapped out in terms of stress. So I had to rush her to the hospital in the middle of her stroke, coming to a gynecologist. Wow. You have to be awake at the wheel.
And that's kind of a key point. You have to know your body, you know, and when something is not right, or if your body, something feels differently, then you have to be in tune with what your body is and what feels normal to you. But what you talked about sleep, one of my earlier guests was a neurologist, and she talked about sleep being a risk factor for dementia, because if you're not getting enough sleep, your brain is not resting, your mind is constantly going. And to me, that was one of the scariest things, especially knowing that, you know, I had a parent who had dementia, and I don't get enough sleep. So it's always very scary for me. Even as much as I try, I just don't get enough sleep. And one of the things she also talked about was the dangers of taking like the NyQuils and the things like that. So that's so key.
Well, let me speak on that, Dr. Paula. Number one, for you personally, you've got to quiet your mind. A part of what you don't do properly, which extends to your audience, okay? Because many of your listeners, they are menopausal women. We number in the millions, all right, across this country. Many of your listeners, despite gender or age, are stressed out. And so they do have insomnia for that reason. Many of your listeners are parents. So they have insomnia for that reason. Grandparent. So they have insomnia for that reason. So the key is, number one, give yourself an hour to clear the room, metaphorically.
Okay.
Don't keep piling on and it's 9 o'clock at night. Stop. There has to be a stop time. Unconditionally. Just like we unconditionally experience gravity. You don't get to float away. You don't get to be tired of gravity. You don't get to be tired of oxygen. Both are a death sentence. So is this, Dr. Paula. If you do not cut it, it's a death sentence, okay? Boundaries is my third advice to you and the audience. Cut it at a certain point. You define your circadian rhythm. I can't tell you when to wake up and when to go to bed, but you know your life. And what I know is you need 1 hour. If you're not a teeny bopper or a kid, they fall asleep soundly. Once you got bills, that's over, okay? People with no bills sleep well. People with bills, we got stuff on our mind. We got stuff to think about. So you literally have to give yourself an hour. And that's where I watch the Dilly stuff, Married to Medicine, I love in hip hop. It clears my mind. Okay. And then I crash. Okay. Melatonin is useful, but the use of any supplement, as the neurologist told you, it's sort of like working out in the gym. Can you do the same workout consistently for 2.5 years and expect good results, Dr. Paula? No. You already did a metamorphic transformation, not just spiritually, not just mentally, not just financially. On every level of your life, I've watched transformation. So you get it. You got to switch it up, right? Financially, whether you play the stocks or whether it's in the gym, you got to switch up your routine. This is part of why group classes work. This is part of why hiring a trainer works. Because what you think up don't work 3 months later. Your muscles get used to it and they give up. Same with your brain, okay? Your brain cannot be hooked on NyQuil. NyQuil, NyQuil, NyQuil season. No, every 12 weeks, you got to switch up what you're doing to sleep well. But
Mm-hmm.
step one, really clear the space.
Love that. I love that. Clear the space, set the boundaries. Okay, okay. What other key strategies can you give to caregivers for managing their stress?
How about walking?
Mm,
So 40 minutes of walking 3 times a week reduces our risk for dementia. That's number one. 40 minutes 3 times a week. Okay.
I'm gonna write
Also,
that down.
yeah.
Mm-hmm.
Also, just in terms of stress, Dr. Paula,
Mm-hmm.
having a pet, yeah,
I'm not the pet god.
that's because you go 20 hours a week. The poor little pet, he would starve. They would call animal control on you.
Never
Okay.
like
You
pets.
you
Never.
could, but they would call animal control on you. You too busy trying to save humanity. For the rest of the first responders in the audience,
Mm-hmm.
pets can de-stress you. It's actually scientifically backed up. Rubbing your pet when you have anxiety, depression. We talked about some of the illnesses that result from being a care provider. It
Mm-hmm.
reduces. See, Paula don't have no depression or anxiety. She could talk on it. She don't know about it. Those of you who experience it, a pet may be better than 3 medications. Okay,
Now I have to be the devil's advocate. You want me to take care of my parent or elderly person or whoever I'm taking care of, and take care of a pet? That's just too much. I'm just
well, right. The pet can't be a pain in the butt. That's
okay.
true. No, that's
Mm-hmm.
true.
Mm-hmm.
Because my pet, for example, I'm not walking duty or doo-doo duty. Okay.
Mm-hmm.
I get to just rub the little animal. So, yeah, no, that's because teamwork, once again.
Mm-hmm.
There's certain things that I delegate to my husband. So,
Mm-hmm.
if you're a team in any way in your household, then the pet can work if they're a loving pet.
Okay. So
Now,
that's why you
any
have all
any
these
pet can
emotional
become a
support
vicious.
animals.
There you go. They are,
Mm-hmm.
and that's a real thing.
Mm-hmm.
But also walking. So what I was going to say is, if you have a dog, then that's your incentive. Okay.
Mm-hmm.
Again, Paula did a transformation without the pet.
Mm-hmm.
Everybody can't do that. Everybody doesn't have the self motivation or the money for the trainer. The little doggy that you get from the animal shelter needs a
Mm-hmm.
walk 2, 3 times a day. So that then now you're walking 2, 3 times a day.
Mm-hmm.
Walking is essential to de-stressing.
It is.
Going out in nature is
Mm-hmm.
consistent with centering or grounding yourself. That's science. Again, none of this is the foo-foo anymore. We've
Mm-hmm.
proven it. We've proven it. So you do these things and you're going to find your endurance, your emotional bandwidth, as I like to say, will
Mm-hmm.
grow. It will grow.
Okay, okay. I'm telling you, you dropped some good tips. Um, my gosh, I feel like we kind of went through the questions that I have. What else do you want to share? What advice or what do you want to share for caregivers or, taking care of their health? Because I know you have tons to talk about, tons of advice and tons of information.
Okay.
Mm-hmm.
Um, there are many other tips because, again, a part of why you started this podcast, Dr. Paula, is to save lives, to extend longevity of life, quality of life.
Yes.
So a lot of that comes back to balance.
Mm-hmm.
We could do a whole podcast on nutrition, but
Mm-hmm.
let's start with what I told your daughter, okay,
Mm-hmm.
who I love and very much a proud auntie to, okay. She is a junior in college and she is a bad mama jamma. So, kudos to her. And I will say what I said to her to your audience: drink half your body weight in water.
Mm-hmm.
And I literally watched that little girl become healthier. Okay.
Mm-hmm.
It was never her goal to be a size 2, but it is
Mm-hmm.
her goal to live to 100. Why not?
Mm-hmm. Mm-hmm.
And
Mm-hmm.
I've watched her health improve with that one suggestion. And as we know, most people who go off to college gain 15 pounds.
Yep.
No, not your daughter. She did not.
Mm.
I'm a witness, okay? I've been
Mm-hmm.
watching her as an auntie. I showed up and showed out for her high school graduation.
You did.
And I've been
Mm-hmm.
watching her every semester of her
Mm-hmm.
fertile life. I'm staying tuned in, okay?
Mm-hmm.
As long as that girl is fertile, I'm the auntie who's tuned in at all times. So I have watched her go to
Mhm.
college from high school and get healthier and healthier and healthier.
Right.
So
Water.
half your body
His
weight in
is
water.
my.
There you go. There you go. It's such a simple thing to do.
Mm-hmm.
Okay.
Mm-hmm.
Even if
Mm-hmm.
you do McDonald's or late night eating or pizza, that's
Mm-hmm.
simple, right? The other thing is try to eat in an inverted pyramid.
Mm-hmm.
And that's the opposite of what most caretakers do. Most caretakers are running, 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 finally get to self at 10 o'clock. That's what my grandmother used to do. She died a terrible death of diabetes.
Mm-hmm.
Don't put yourself last all day. You know what your body takes that as? Okay, let me slow my metabolism
Metabolism.
way down because I
Mm-hmm.
come last.
Mm-hmm.
You
Mm-hmm.
want to jump start your metabolism at the start of the day.
Mm-hmm.
Eat in an inverted pyramid. Force yourself to have a breakfast. Put the smoothie at night in the blender and just don't push start.
Mm-hmm.
Only you got to add the milk in the morning and hit start, right?
Mm-hmm. Mm-hmm.
That's the way the news reporters do it. They're up at
Okay.
3:30. They need blind movement until they hit the vehicle.
Mm-hmm.
Okay?
Mm-hmm.
The shower is already set. The shampoo is set.
Mm-hmm.
The outfit, actually, Dr. Paula taught me this. We did a sleepover, and this woman had such an overnight bag. I said, whoa, I gotta
Tell all
redo.
the
I
secrets.
gotta redo my luggage and how I packed, Dr. Paula. What? She had everything but the kitchen sink in the bag. But
Mm-hmm.
you got to think ahead.
Mm-hmm.
Mothers do it, right, Dr. Paula? You
That's
have a
right.
baby. If you're 23, you're going to grow up fast
Mm.
because everything for that kid has to be done the night before.
Mm-hmm. Mm-hmm.
Yeah,
Yeah.
every caretaker should do that. That
Mm-hmm.
way you get to eat a lot. You
Mm-hmm.
stock your refrigerator. Eat
Mm-hmm.
fruit, eat veggies. You know what? Go to the grocery store and buy that big veggie tray without
Mm-hmm.
the party. And just
Mm-hmm.
all day you dipping veggies in dip and eating it. So you're not starving at night and then eat
Mm-hmm.
Popeyes. Don't do that.
Mm-hmm. So, it's interesting again that the way that you are expressing the caretaking is like being a parent, although we know this. It's like you're now becoming a parent to your parents,
That's it.
and the roles have reversed. But I guess being a caretaker, you don't think about those things you did when
Mm-mm.
you were parenting your smaller kids, like making sure you're prepared, making sure you eat. You're so busy, you're so focused on taking care of this person, but you're not thinking about it in that frame of mind. So that's a good way to think about it, to kind of have a different mindset. You have to think about it like the same things I did when I was taking care of my kids. I'm just taking care of an older person now. So making sure I'm prepared, making sure that, when they sleep, I just had this conversation with my niece who has a newborn. When he sleeps, you sleep.
That's it.
Um,
That's it.
yeah, I love it because you just put a whole new perspective on an outlook on looking at it differently. Just
That is the beauty of your
changing,
guest. That's the
yes,
beauty
to
of this
change your
show.
mindset, to look at it in a different perspective. Wow. Love it, love it, love it, love it. So we have kind of covered a lot in these past few minutes. Balance, nutrition, sleep being the most important thing, sleep, and taking care of your health, taking care of yourself. Again, this is why I'm doing this podcast. We don't take care of ourselves as caregivers. We make sure that the person
Yeah.
we're caring for goes to the doctor and gets their
Yeah.
checkup, and we
That's it.
neglect ourselves. But we have to start putting our mask on first. Any words of advice that you'd like to give to caregivers besides all the precious jewels you've dropped already?
I have one last pearl to
Mm-hmm.
drop on your audience in this session, Dr. Paula, because I know we'll have more. And
Yes, this
again,
is
I
just the
want to, I want to,
beginning.
I want to take the opportunity to thank you because did you not have the vision then they would not have the opportunity. So the fact that you focus exclusively on our first responders that are care providers across the diaspora of gender, age, ethnicity, and country, okay? Globally, we are caring for an aging, booming population, right? So the baby boomers, God willing, they don't die young. They have no choice but to age out. And so we are caring for them.
Yes.
And they don't necessarily have a let me bow down. See, that's the difference with the kid and the elder. The elder still want to be your mama. They just who you talking to? Who are you telling? You know, my mother's got that part at 79, and she won't like me saying it, but it's true. You know, I say something 3 times, she doesn't hear it. So now I yell. I said it's hot dogs. Who are you yelling at? So it's not easy. Let's add that part, Dr. Paula.
That's right.
The reality is it is not easy being your mama's care provider, your daddy's care provider, your uncle. I had an uncle when I was in medical school. He had leukemia. Girl, I was feeling myself. You know, finally, I've been saying I want to be a doctor since 5 years old. I'm finally in medical school. I know something. And he's at my hospital, at my medical school. I was compelled from my soul to go to this man and pour into him. He wasn't laying in the right position, okay? His nurse would have told him the same thing, but I got to him first. So I'm trying to tell him to reposition. Girl, he quickly dismissed me. Oh, yeah. You are my niece. I need you to leave the room. That's an elder, okay? So how do you love, protect, safeguard? My best advice, you better woosah before. Okay? What I do for my own mother, who, grace of God, does not have dementia, but she is 79, going on 80. Okay. So that's a different mama than the one I went off to college from. I've got to be centered myself. It's more than an oxygen mask the young moms need to parent a 2-year-old, because a 2-year-old you can discipline. Go to the corner. Now try that with the elder.
Whether they have dementia, now who you talking to?
They will get you. Okay. So you cannot outdo them. You can't out yell them. You can't be irritable with them. You can't be short with them. At the end of the day, you live with the consequences of your behavior and your words to them. Okay. And that maternal guilt times 1,000. You said it to your mama, your elder. You will never allow your conscience to live that down. You better woosah and meditate and eat some brownies and sleep well and make a bowel movement before you enter the room, or you will snap. You might snap. The best of us can snap.
Yeah, you got to have a lot of patience. Absolutely. So woosah, eat a brownie. You ain't say what kind of brownie, but look, we're not going to talk about that. Wow. Awesome advice. You know, this, like you said, this is just the first of many conversations we will have, because you always keep it real. Thank you. Thank you for pouring into my audience. You know, thank you for sharing your tips and all the great advice. I appreciate you. And I just love you. So thank you,
I love you
Dr.
back.
A.
I love you back. And I'm just gonna end it with telling one of your secrets. Okay.
Oh gosh.
I've
I've
already told on you. I can't help it. I'm one of your close friends. And one thing about you, you're super transparent. You know, you don't have a different Paula with this organization, a different Paula in your time off, a different Paula when you're president, a different Paula when you go to work, when you're mommy, when you're wifey. You're the same Paula all the time. So how do you endure, since I outed you and said you try to go like an Energizer bunny 20 hours a day, and you admitted to your audience that you have insomnia? Well, Paula's little secret is travel, people. She used her passport like most people use lip gloss. So that's my final advice to caretakers. Get out of Dodge.
Now
Get a
that's hard.
life.
Now wait. Now you cannot say that to caregivers because that's the last thing on their mind. Traveling, even though some of them wish they can, it's so difficult.
It
And
is
I am
difficult.
I am going to do a session about respite care because a lot of caregivers don't know about respite care, but travel is a good thing to
Well, then
just
go to a
clear your
spa.
mind.
Go to a
There
have a
you go.
spa day.
There you go. That's what we'll say. Go have a spa day. I love it. I'm planning me a spa day right now. So
You got to.
on that note, Dr. Afriye Amerson always keeps it real. She is one of the best. Thank you. And we will definitely have you back on again soon. Mwah!
Thank you for having me in your first year, Paula. I love it. I will be back. I love your
Yes.
audience.
Thank you.